guys, welcome back to the Friday Q&A with Dr. Dre, where I'm going to be addressing your skincare related questions that have come throughout the week. If you're joining me today and you're new, welcome. I encourage you to subscribe. Today I'm filming from my hotel here in sunny Orlando, where I'm attending the American Academy of Dermatology meeting for continuing medical education. I'm having a fantastic time learning a lot and also enjoying all the fun activities that Orlando has to offer. And I've enjoyed sharing that with you all in my daily vlog, so I encourage you to check those out if you're interested. It's been a lot of fun. You know, by the way, I'm totally loving my my sun hat that I got here from Bar. I'll link it down below, as well as my sun protective cardigan. It's really keeping my it's really making it a lot easier to not have to reapply sunscreen while I'm here. It's just been fantastic. Look at that, it's so vogue. Anyways, let's get started. So the first question comes from Kenna, and she asks for my thoughts on micellar waters. If you live in an area with particularly harsh water, I think a micellar water is a nice option for gently removing makeup. However, I do caution you that sometimes cosmetics can have ingredients in them that you may become sensitive to or that may be irritating to you. So look for ones that are fragrance-free and don't have a lot of botanical ingredients that could potentially be irritating to you. The next question comes from NXB314. She comments on my hat and says it's very cool. Thank you so much. I'm totally loving it. Her question is, regular clothes and hats provide sun protection too, right? Absolutely. And the best types are those that are dark fabrics with tight weaves. The broader the brim, the more protection you're going to get, so that's something to look for when choosing your hat. And when you're choosing clothing to offer sun protection, you want to look for fabrics with a tight weave and preferably dark clothing. The reason that I'm a fan of the Bar products, however, is that when it's super hot out, you may not want to be wearing thick black clothing. Bar has Universal Protective Factor 50, and their fabrics are lightweight, breathable, and they come in a variety of light colors like this cream color that my cardigan is here. So that's why the Bar has been my preference. The next question comes from 1979 Caymans. She asks, what cleanser do you use? I've been using the Neutrogena foaming face wash just to remove my makeup in the shower. I've used a variety of cleansers, but I encourage you to check out my skincare routine video where I go over my daily skincare routine, and I also in the description box of that video list the products that I use in case you're interested. The next question comes from Lucky Aguirre. Is apple cider vinegar safe to use on your face? And I would caution you against using this. There have been case reports of chemical burns and severe irritant dermatitis from individuals applying apple cider vinegar to the face. So the next question comes from Jayoon Kim. I'm really sorry, I know I'm totally butchering your name. How many months is benzoyl peroxide gel in a tube good for? And I'm not entirely sure, but I go through a tube about every 4 to 5 months, and I think it's prudent to switch it out every 4 to 5 months, just to be on the safe side that either the active ingredient or the inactive ingredients have not somehow expired. Also asked me to comment on hard water and acne. There has been a noted association with worsening acne and hardness of water, so that is something to bear in mind. However, I also would point out that bar soaps can also clog pores and potentially worsen acne by virtue of some of the additives in them. And your fabric softeners and detergents that you use in your to wash your towels may also be contributing factors as well. I myself don't even use a towel on my body. I just air dry my skin, as I've talked about in the vlogs. The next question comes from Elle Grace, and she asks what can be used to combat the dryness that's associated with using benzoyl peroxide. I use Neutrogena oil-free moisturizer to my face. I apply it to my face when it's wet, and then I let the moisturizer seal in the water onto my face. And once my skin is dry yet hydrated from the moisturizer, then I apply the benzoyl peroxide. And I found that that has really cut down on the amount of irritation and dryness. The next question comes from John Johnson, who asked me to comment on my thoughts on the double cleansing method. I think using an oil-based cleanser makes quite a bit of sense for physically removing dirt and oil from your face, as like dissolves like, and that could probably help remove makeups and things like that. And then following it up with a gentle cleanser to remove any residual oils and dirt. How do you feel about using Dove soap as a face wash? And as I mentioned earlier, bar soaps can contain additives to help them solidify that potentially can clog your pores. So I don't advocate using bar soaps on the face. Okay, the next question comes from Sophie M0006. But about your recommendation for keeping a humidifier in the bedroom. So that's harkening back to my dry skincare tips video, which I encourage you to check out if that's something that you're interested in. But I recommend especially in the winter time when our ambient humidity drops, there's less moisture in the air and our skin becomes more susceptible to dryness, irritation, and itch. And a cool mist humidifier in the bedroom can help rectify that situation. I don't think a bowl of warm water placed next to the bed will put out enough, will put out a robust enough humidity stream, but it's not something that I've ever compared. The next question comes from Leah F497, who asks me about calendula and my thoughts on calendula. Calendula is a botanic ingredient that supposedly is helpful for inflammation, and it hasn't been rigorously studied. And as I always say on here, botanics are not regulated by the FDA. And with calendula, there are reports and something to be aware of that of irritation and allergy developing to it. So that's always something to keep in mind. Likewise, she asks about my thoughts on arnica. Arnica is a homeopathic topical pain relievers. And I myself, I've mentioned this in the vlogs before, I was really recalcitrant to believe that it did anything. I tried it out on some sore muscles, and I can't explain it, but it totally worked in alleviating the soreness. But again, just like calendula, you can develop a contact hypersensitivity, which would lead to a worsening rash. So always be aware of that with these things. But I myself did actually find that it did relieve soreness quite nicely. So the next question comes from Patty S. She asks, I noticed you don't moisturize prior to your sunscreen application. As you guys may have noticed in my daily vlogs, I use the CeraVe sunscreen all over my face, neck, and ears. And this sunscreen has an ingredient called ceramides, which are helpful in restoring the skin barrier and useful as a moisturizing ingredient. So I use this product as both a sunscreen, as both a broad spectrum sunscreen and my daily moisturizer. And she asks, I have dry 58-year-old skin and need more moisturizer than the CeraVe offers. It's the Neutrogena Hydra Boost gel, which is a hyaluronic acid based gel. And the way that I found it to be effective is applied to a wet face, gloms on water molecules, and helps them stay on the skin. So I put that on my wet face, let it air dry, and then come in with my moisturizing sunscreen of choice. And I found that the Hydra Boost literally does that. It enhances my moisturizer. Is it okay if I use an 8% alpha hydroxy acid every day, at least once a day, sometimes twice as per the directions? Is that necessary? Depending on what your skin needs are, in general, I don't think exfoliating more than 2 to 3 times a week is really necessary, because with over-exfoliation, essentially what you do is dry out the skin and lead to more oil. That leads to more oil production, that leads to more prominent pores. It increases the penetration level of ultraviolet radiation, contributing further to photoaging, contributing further to wrinkles, potentially contributing to increasing your skin cancer risk, as well as exacerbating and or contributing to discoloration on the face, none of which you want. So, you know, go slow with the exfoliants. I was wondering if applying makeup over a chemical sunscreen devalues the sunscreen. Thanks for all of your help. With chemical-based sunscreens, it is, as I mentioned in last week's sit-down Q&A, it's important to apply them 15 to 20 minutes before going outdoors. This allows them to form a protective film. As far as I'm aware, makeups don't devalue them per se, or devalue their SPF. The next question comes from Lubzy1, who asks, can I ask if Differin cream will help with acne scars on my chin and chest? Differin, guys, is adapalene. It's a topical retinoid that is now available over the counter and previously was only available by prescription. It's FDA approved for acne only, and it works on slightly different receptors than the other topical retinoids like tretinoin and tazarotene, or Retin-A and Tazorac as they're as their brand names are. And it is unlikely that adapalene or differin is going to be helpful for scars, because the receptor combination that it works on isn't quite at that level in the skin. So unlikely. Probably what would be more helpful would be a prescription retinoid like tretinoin, depending on where in your acne treatment you are. It's something to talk about with your healthcare provider and see what their thoughts are on that. The next question is, does tretinoin or Retin-A, as its brand name is, help with melasma? And there is actually a combined cream called Triluma that has tretinoin, hydroquinone, and a little bit of topical steroid in it that is FDA approved for melasma. So yes, there is some evidence that a tretinoin cream can be helpful for melasma. It's something to talk about with your provider if you're interested. Key with melasma that is essential to whatever treatment path you pursue, the absolute essential thing that I cannot overemphasize enough is sun protection. Because regardless of what you do, inadequate sun protection renders the intervention useless. The next question comes from Victoria Lovelace, who asks about Tinea Versicolor, which, if you guys are familiar with this, it's a common little skin condition that is related to just a yeast that naturally lives on our skin. A way to kind of control this problem is to use an anti-dandruff shampoo containing zinc pyrithione or selenium sulfide. So Head and Shoulders shampoo or Selsun Blue shampoo. It's a way to control it. It won't cure it though. I had another question, and I apologize, I can't find it, but I remember it. And it was if I could make a recommendation for what SPF is necessary for dark skin types like African American skin. And that's an excellent question. It's a misconception that dark skin types don't need sunscreen. The same recommendations essentially hold true, as I would choose a zinc or titanium dioxide based broad spectrum SPF 30 to 50 sunscreen. Alright guys, so I hope you enjoyed today's Q&A coming from the Sunshine State here. We're protected by Coolie Bar. I'll link him down below, both my cardigan and my hat. So I encourage you to give this video a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys in my next skincare video. Bye!